हेलो दोस्तों, एक बार फिर से आप सभी का स्वागत है हमारे चैनल नर्सअड्डा में। आज हम आपके लिए लेकर आ चुके सेट नंबर 20 नॉर्सेट एग्ज़ाम का सैम्पल पेपर। ओके, जैसे कि आपको पता है नॉर्सेट एग्ज़ाम 2 स्टेज में होता है। पहले होता है प्रिलिमिनरी, नेक्स्ट होता है आपका मेंस। ओके, दोनों एग्ज़ाम में ये बहुत यूज़फुल होने वाला है। तो आपको क्या करना है, वीडियो को पॉज करके पहले अपना आंसर को गेस करना है। ओके, उसके बाद वापस प्ले करके आंसर देखना है। ओके, चलिए शुरू करते हैं आज का क्वेश्चन। क्वेश्चन नंबर 1, एन एग्जाम्पल ऑफ एन acute organic mental disorder is। Your correct answer is option B, delirium. Okay, explanation is delirium is an acute disturbance of attention and cognition, whereas dementia is generally chronic and progressive. Okay, तो यहाँ पे क्वेश्चन में पूछा गया है कि अक्यूट मेंटल डिसऑर्डर, तो यहाँ आंसर आएगा डिलीरियम। अगर एग्जामिनर ने क्रोनिक डिसऑर्डर पूछा होता तो आंसर होता डिमेंशिया। ओके, नेक्स्ट क्वेश्चन, द मोस्ट लाइकली सिस्टमिक एडवर्स इफेक्ट ऑफ कॉम्बिनेशन कीमोथेरेपी for the treatment of metastatic carcinoma include। Your correct answer is option C, leukopenia. Explanation is combination chemotherapy commonly causes bone marrow suppression, okay, which leads to leukopenia or neutropenia, anemia and thrombocytopenia. Okay, basically it reduces the immunity power. Next, glaucoma is primarily associated with। Your correct answer is option A, increased intraocular pressure. Next one, after stomach surgery, brown to black drainage from the NG tube after about 24 hours most likely indicates what? Your correct answer is option C, old or clotted blood. Explanation, blood exposed to gastric acid may become brown or coffee ground or black in appearance. Okay, next one, if the labor ends within 3 hours with 2 to 3 painful contractions, it is called। Your correct answer is option B, precipitate labor. Next one, after a road traffic accident, a patient's motor response is abnormal extension. What does this indicate? Your correct answer is option A, decerebrate posture. Explanation is extension of the arms with internal rotation is characteristics of decerebrate posturing and indicates severe neurological injury. Next one, which is not a type of lochia? Your correct answer is option D, serum. Next, common fracture encountered in a baby during delivery. Your correct answer is option B, clavicle. Next one patient came in the clinic with redness, pain and tenderness in the breast. What would be the possible cause of the breast abscess? Your correct answer is option A, Staphylococcus aureus. Most common STD in men. STD means sexually transmitted diseases in men. Your correct answer is option C, chlamydia. Next, to assess further bleeding after thyroidectomy surgery, the nurse should primarily observe. Your correct answer is option C, hemorrhage at the operative site. Next one, explanation is after thyroidectomy, the nurse should closely observe the operative site and neck for bleeding or swelling because a neck hematoma can compromise the airway. Next one, in ICU, a nurse is assisting a doctor for insertion of an NG tube in a comatose patient. What position should be given during the procedure? Your correct answer is option C, high Fowler position. A patient's Foley's catheter is removed before 24 hours. Now his or her urine output is less than the expected volume. What will the nurse do first? Your correct answer is option A, check bladder for distension. Next one, appropriate nursing action to manage primary PPH is. Your correct answer is option D, massage the uterus until firm. Explanation: uterine atony is the most common cause of primary PPH. Fundal massage helps to stimulate uterine contraction. Next, an unconscious patient admitted in the ICU. What is the first priority of this patient? Your correct answer is option A, airway. Next one, which sign is seen in pancreatitis? Your correct answer is option A, Cullen sign. Cullen sign is a bluish discoloration which seen in around the umbilicus, okay, and it may occur in severe or hemorrhagic cases of pancreatitis. Next one, a 65-year-old male present in the emergency with severe chest pain for the last 2 hours. An acute MI is diagnosed. What would be the treatment of choice? Your correct answer is option B, streptokinase. Next one, how can discoloration of teeth after iron syrup be prevented? Your correct answer is option D, syrup given through a straw. Next one, a patient ABG result shows pH 7.48, PaCO2 32 mmHg, PaO2 88 mmHg and bicarbonate level is 24 milliequivalent per liter. According to these results, patient is suffering from. Your correct answer is option B, respiratory alkalosis. Okay. So here pH is 7.48, that is the normal pH level कितना होता है 7.35 to 7.45, तो ये 45 से ऊपर है मतलब हाई है, तो ये हो गया अल्कोलोसिस. ओके. नेक्स्ट PaCO2 इज़ 32, तो PaCO2 का लेवल कितना होता है 35 to 45. ओके. तो CO2 का लेवल यहाँ पे कम है, मतलब नॉर्मल रेंज से बाहर है, तो ये हो गया रिलेटेड टू रेस्पिरेटरी. ओके. तो ऐसे हमारा आंसर आता है यहाँ पे रेस्पिरेटरी अल्कलोसिस. नेक्स्ट वन, द नेट प्रोटीन यूटिलाइजेशन NPU of which of the following food is the highest one? Your correct answer is option D, egg. Next, according to WHO, the surgical site infection is generally considered when infection occurs. Your correct answer is option A, within 28 days after surgery. The most common complication of the respiratory system following abdominal surgery is. Your correct answer is option B, atelectasis. Explanation is postoperative pain, shallow breathing, prolonged immobility, all can cause the alveolar collapse. ओके. तो ये प्रिवेंट करने के लिए डॉक्टर एडवाइस करते हैं डीप ब्रीथिंग एक्सरसाइज, कफिंग एक्सरसाइज और इंसेंटिव पैरोमीटर एक्सरसाइज. ओके. Next, a patient is scheduled for elective surgery. Which of the following is not an important nursing responsibility one day prior to elective surgery? So here आपको क्या देखना है, इलेक्टिव सर्जरी के पहले नर्सिंग रिस्पॉन्सिबिलिटी क्या है वो देखोगे तो आपको ऑलरेडी आंसर मिल जाएगा. ओके. पीएससी चेक करते हैं, यस करते हैं. टीचिंग, यस. कंसर्न वेरिफिकेशन, यस. रिहैबिलिटेशन, नो. ये रिहैबिलिटेशन आता है सर्जरी के बाद आता है. ओके. प्री ऑप में नहीं आता, ये पोस्ट ऑप केस में आता है. ओके. सो हियर योर करेक्ट आंसर इज ऑप्शन डी, रिहैबिलिटेशन. Next one, a patient with end-stage renal disease is admitted to the ICU. Which clinical feature is not expected in end-stage renal disease? Your correct answer is option C, increased immune system. Immune system increase नहीं होता है, disturb होता है. Okay. Impaired होता है. Okay. Next one, a patient receiving hemodialysis develop bleeding from the AV fistula site. What should the nurse do first? Your correct answer is option A, immediately apply pressure with sterile gauze. Which of the following is not a sign of angina? Your correct answer is option C, generalized body pain. Next one, which of the following is not a typical finding in leukemia? Your correct answer is option C, polycythemia. Maternal serum alpha fetoprotein is primarily used for screening for. Your correct answer is option A, neural tube defect. Where do you assess jaundice most appropriately in a child? Your correct answer is option B, skin over the sclera. Damage during direct laryngoscopy most commonly occurs to the. Your correct answer is option C, maxillary incisor. Next one, a patient with hematemesis is admitted to the hospital. What is the most appropriate immediate diet? Your correct answer is option D, NPO. Explanation. During active upper GI bleeding, oral intake is usually withheld until the patient is stabilized and evaluated. Next one, who is known as the father of the Green Revolution in India? Your correct answer is option A, MS Swaminathan. Next one, which antihypertensive drug is contraindicated during pregnancy? Your correct answer is option C, enalapril. A complication associated with prolonged high concentration oxygen therapy in premature infant is. Your correct answer is option B, retinopathy of prematurity. Next one, during ongoing surgery under general anesthesia, which parameter is the first priority? Your correct answer is option B, vital signs including oxygen saturation with pulse oximeter. Next one, which medication is commonly given to a patient in the preoperative period to reduce infection. Your correct answer is option B, antibiotic. Next one, which of the following is an example of a monoclonal antibody? Your correct answer is option B, rituximab. World Epilepsy Day is observed on. Your correct answer is option A, 26th March. Ecchymosis refers to. Your correct answer is option C, bluish purple discoloration of the skin due to bleeding into the tissues. Which radioactive substance is used in Kupffer cell imaging? Your correct answer is option A, barium sulfate. Raccoon's eye are commonly seen in. Your correct answer is option B, basilar skull fracture. According to WHO protocol, the time required for hand washing with soap and water is. Your correct answer is option C, 40 to 60 seconds. Cullen sign is most commonly seen in. Your correct answer is option C, acute pancreatitis. A common complication following radiotherapy of oral cancer is. Your correct answer is option A, loss of taste. The most common cause of upper respiratory tract infection is. Your correct answer is option A, rhinovirus. Abnormal copper accumulation is seen in which disease? Your correct answer is option A, Wilson's disease. Which of the following is the fastest growing nail? Your correct answer is option C, fingernail of the middle finger. Explanation: fingernail generally grow faster than toenails, and among the fingernail, the middle finger one grows the fastest. Okay. Next one, National Leprosy Day in India is observed on. Your correct answer is option C, 30 January. Rigor mortis means. Your correct answer is option A, stiffness or rigidity of muscles after the death. Rule of 9 is used to assess. Your correct answer is option A, severity of burn or extent of burn. After total hip replacement, the patient should be positioned with. Your correct answer is option C, abduction pillow between the legs. Characteristic pain of MI is. Your correct answer is option B, crushing retrosternal pain radiating to arm or jaw. Next one, full form of Niti Aayog is. Your correct answer is option A, National Institute for Transforming India. Next one, a patient has severe metabolic acidosis. Which respiratory pattern is expected? Your correct answer is option B, Kussmaul respiration. Which of the following is a sign of respiratory acidosis? Your correct answer is option A, headache and confusion. Leukoplakia is best described as. Your correct answer is option A, a thickened white patch of oral mucosa is known as leukoplakia. Okay. Next one. The main purpose of antibiotic prophylaxis before certain dental procedure is a prevention of. Your correct answer is option A, infective endocarditis. The priority assessment for a patient following nephrectomy is. Your correct answer is option B, urine output and fluid electrolyte status. Fluoride deficiency can result in. Your correct answer is option C, increased dental caries. Who discovered the principle of buoyancy? Your correct answer is option A, Archimedes. Which of the following is a characteristic effect of the sympathetic nervous system? Your correct answer is option C, fight and flight reaction. Next one, which of the following pathogen causes gas gangrene? Your correct answer is option B, Clostridium perfringens. Undersupply of the neurotransmitter serotonin is linked to. Your correct answer is option D, depression. A patient with no known allergies is to receive penicillin every 6 hours. The nurse observes a fine rash on the patient's skin. What is the most appropriate nursing action? Your correct answer is option B, withhold the medication and notify the physician. Next one, where is buccal medicine supposed to be placed? Your correct answer is option C, between the cheek and gum. The method of setting formal guidelines before starting a work is known as. Your correct answer is option D, planning. HIV virus basically consists of. Your correct answer is option C, single-stranded RNA. Next one. Which of the following is an infection of lower respiratory tract? Your correct answer is option C, bronchiolitis. Next one. Today is A. Your correct answer is option D, contraceptive. Myringotomy is a surgical procedure involving. Your correct answer is option B, incision of the tympanic membrane. The drug of choice for the treatment of filariasis is. Your correct answer is option D, diethyl carbamazine citrate. Which of the following is the best diagnostic test for detecting peptic ulcer? Your correct answer is option D, endoscopy. Next one, which of the following infection can be transmitted through blood transfusion. Your correct answer is option D, all of the above. A patient develops swelling of the legs on applying pressure over the swollen area and indentation remains after the pressure is released. This finding is known as. Your correct answer is option B, pitting edema. A patient with severe hypovolemic shock is admitted to the emergency ward. Which finding requires the most immediate attention? Your correct answer is option B, blood pressure 80 by 50 mmHg. Next one, a nurse is preparing to administer insulin. Which route is most commonly used for routine subcutaneous insulin administration? Your correct answer is option B, subcutaneous. Next one, a patient with COPD is receiving oxygen therapy. Which oxygen delivery device provides a precise, controlled concentration of oxygen? Your correct answer is option C, Venturi mask. A patient receiving chemotherapy has a platelet count of 20,000 per mm cube. Which nursing intervention is most appropriate? Your correct answer is option B, avoid activities that cause bleeding. Next one, a postpartum woman suddenly develops severe dyspnea, chest pain and cyanosis. What is the nurse's priority action? Your correct answer is option B, place the patient in a comfortable position and assess airway and breathing. Next one, a child with severe dehydration is lethargic and unable to drink. What is the priority management? Your correct answer is option B, start appropriate IV fluid therapy. A male physician is examining a female patient. Which nursing action best protect the patient privacy and comfort? Your correct answer is option B, arrange for a female chaperone to be present. Next one, which laboratory investigation is commonly associated with the diagnosis of systemic autoimmune disorder such as SLE? Your correct answer is option A, anti-nuclear antibody or ANA. A person frequently expresses hostility indirectly, resists requests, and deliberately delays tasks. This behavior is characteristic of. Your correct answer is option B, passive aggressive personality disorder. Pattern. Next one, in OCD, which statement is correct? Your correct answer is option B, obsessions are intrusive thought and compulsions are repetitive behavior. Okay. Next one, approximately what percentage of an adult body weight is normally composed of total body of water? Your correct answer is option C, 60%. Next one, which is considered the second stage in the classical multi-stage process of chemical carcinogenesis. Your correct answer is option B, promotion. Who was the first president of India? Your correct answer is option C, Dr. Rajendra Prasad. Next one, which is the largest planet in our solar system? Your correct answer is option C, Jupiter. Next one, if 25% of a number is 80, what is the number? Your correct answer is option C, 320. Next one, a sum of 5,000 rupees is invested at 10% simple interest per annum for 2 years. What is the interest? Your correct answer is option C, 1,000 rupees. Explanation is SI simple interest is equal to PRT divided by 100. P is principal, R is rate of interest and T is time. Okay. So here principal is 5,000 and rate of interest is 10 and time is 2 years. Okay. Divided by 100. By this we get the right answer 1,000 rupees. Okay. Next question. The ratio of nurses to doctors in a hospital is 3:2. If there are 60 nurses, how many doctors are there? Your correct answer is option B, 40. Explanation is ratio is 3:2. Nurses to doctor. Okay. तो nurses का part है 3 parts is equal to 60. So 1 part is 20 and doctors का part है 2 into 20 that is 40. Okay. Next, a train travels 240 km in 4 hours. What is its average speed? Your correct answer is option C, 60 km per hour. तो यहाँ पे एक फॉर्मूला यूज़ करना है आप लोगों को, स्पीड इक्वल टू डिस्टेंस बाय टाइम. ओके, तो आपको आपका आंसर मिल जाएगा. ओके. नेक्स्ट, व्हाट इज द एवरेज ऑफ 12, 18, 20, 25 एंड 30? योर करेक्ट आंसर इज ऑप्शन सी, 21. Average is sum of number by number of number. Okay. Next, if a product costs 800 rupees and is sold for 920 rupees, what is the profit percentage? Your correct answer is option C, 15%. Next one, which Indian state has the longest coastline? Your correct answer is option B, Gujarat. Next one, which city is known as the Blue City of India? Your correct answer is option B, Jodhpur. A boat travels downstream of 18 km per hour and upstream at 10 km per hour. What is the speed of the boat in still water? Your correct answer is option A, 14 km per hour. Okay. Explanation is speed in still water is downstream speed plus upstream speed divided by 2. Okay. So here the downstream speed is 18 and upstream speed is 10 divided by 2. You get the right answer 14 km per hour. Okay. तो ये यहाँ का फॉर्मूला है, इसे बाय हार्ट करना है आपको. ओके. नेक्स्ट, ए बोट ट्रैवल 30 km डाउनस्ट्रीम इन 2 hours and the same distance upstream in 3 hours. What is the speed of the stream? यहाँ पे स्ट्रीम का स्पीड पूछा है तो यहाँ पे दूसरा फॉर्मूला आपको अप्लाई करना है. ओके. जिनको फॉर्मूला याद है उनको ये आंसर ईजिली मिल जाएगा। योर करेक्ट आंसर इज ऑप्शन डी 2.5 किलोमीटर पर आवर। ओके, एक्सप्लेनेशन, स्पीड ऑफ स्ट्रीम इज डाउन स्ट्रीम माइनस अपस्ट्रीम डिवाइडेड बाई 2, ये है वो फॉर्मूला। ओके, तो क्वेश्चन में डाउन स्ट्रीम स्पीड दे रखा है, अपस्ट्रीम स्पीड दे रखा है, और ये दोनों का माइनस करके डिवाइडेड बाई 2 करेंगे तो आपको स्ट्रीम का स्पीड मिल जाएगा। ओके, तो इसी के साथ हमारा आज का सेशन कंप्लीट होता है। कल वापस आएंगे एक न्यू सैम्पल पेपर के साथ। अगर आपको हमारा ये वीडियो थोड़ा सा भी हेल्पफुल लगा तो चैनल को सब्सक्राइब करिए, वीडियो को लाइक और कमेंट ज़रूर करें।